After the third appointment, and after speaking with loved ones if need be, and after looking at scores on self-report assessments, if I feel that I still need more information, I will either meet with the client again to ask additional questions, or I'll ask if they have anyone else that they would be willing to allow me to speak with, because I don't want to make, a rash decision if I'm not absolutely positive of what's going on. The final assessment appointment is a 90-minute feedback session, and I use this session to do many things. The goal is basically to do whatever is helpful to my client. I provide diagnosis first. I don't think it's useful to hold that back, and then usually there's a processing period. So people have emotions when they hear whatever the diagnosis might be, and I process through that and what does it mean to you and how are you feeling right now. Then I'll explain how I came to my clinical decision, how I saw them meeting whatever criteria, how I didn't see them meeting whatever criteria. This is a collaborative session, so I want the client to be able to participate and ask questions whenever. After I have explained how I came to my clinical decision and diagnosis, and after the client has asked any questions that they might have, I go into recommendations. I have a whole slew of recommendations, and I use different ones for different clients based on their needs. At the beginning of the assessment, I often ask what is going to be the most helpful for them. Why are they doing this assessment, and what do they need to get out of it? And so I use that information to create recommendations for them. If I have a client who likes to have rule-based information, they like to have a roadmap to where they're going, I will create a step 1, a step 2, a step 3, and I try to make the recommendations work with the person's brain style. I also provide referrals for neurodiversity affirming therapists, psychiatrists, psychiatric nurse practitioners, occupational therapists, whom I'm always looking to connect with. So reach out to me if you are one of these providers and you're neurodiversity affirming and you would like to collaborate with me, because I always need new clinicians that I trust that I can send my clients to. So that pretty much sums up the adult autism assessment process that I go through with my clients. I can also go through how I do the ADHD testing, or how I do assessment for other conditions or learning differences. Let me know in the comments if there are any other types of assessment that you're interested in.